Of all the senses, sight is perhaps the one we rely on most, and the one that can be the most devastating when damaged or lost. Eye injuries can be painful, disfiguring, debilitating, and can radically change your whole way of life. Just consider the possible consequences of a serious injury to your eyes. At jeopardy could be your ability to read, write, drive, and of course, your ability to work. There are many potential hazards in the workplace that can lead to eye injuries. To understand just how vulnerable the eye is, it's useful to first take a look at the structure of the eye. The eye is located in a bony socket called the orbit, where it's suspended and surrounded by fat, muscle, and blood vessels, together with motor and sensory nerves. The eye is made up of several layers of tissue. These layers perform several functions like protecting the internals of the eye, control of muscles and blood flow, and of course, receiving visual images to be transmitted to the brain. The outer or white part of the eye is the sclera. It's a tough membrane which maintains the shape and form of the eyeball. The colored part of the eye is called the iris. The black center is called the pupil, which contracts or dilates depending on the amount of light passing through it. The iris and pupil are covered by a protective coating called the cornea. Behind the iris and pupil is the lens, which projects the image onto the retina. The retina, which is located at the rear of the eye, is lined with photoreceptor cells called rods and cones. These rods and cones transform light into electrochemical nerve impulses, which are then transmitted to the brain by the optic nerve. The eye is a fragile, sensitive organ that can be damaged when exposed to any one of a number of different hazards. In the workplace, the vast majority of these hazards can be categorized under the following headings: physical blows to the eye, foreign objects entering the eye, exposure of the eye to hazardous substances, and exposure of the eye to radiation sources. Severe or sudden blows to the eye are likely to result from protrusion hazards. Poor housekeeping practices can lead to these types of hazards being found throughout the workplace. The use or misuse of tools, particularly hand tools, is the other major cause of sudden physical blows to the eye. Injuries can result from the tool itself or from the activity being carried out. Even if there is no obvious injury to the surface of the eyeball or the eye socket, a physical blow to the eye can cause serious internal damage. Hemorrhaging into the aqueous humor, the fluid behind the cornea, could occur. Symptoms of an internal injury from a physical blow include impaired, blurry, or double vision. The most common workplace eye injuries involve foreign bodies coming into contact with, becoming embedded in, or actually penetrating the eyeball. These foreign bodies could be dust, fragments, or small particles produced by various machines, processes, or activities. Of particular concern are activities where particles may be propelled at high speeds, such as grinding, drilling and cutting, sandblasting, welding, chiseling, polishing, and hammering. Many flying particles that pose a hazard to the eyes are tiny, as small as a pinhead or smaller, and penetration of the eye by one of these particles may not leave an obvious mark. Fragments of metal, sparks, and other tiny particles striking the eye at high impact can cause a variety of serious eye injuries. Hazardous substances are found in every workplace: solvents, acids, alkalis, insecticides, glues, and other hazardous substances can all be potentially harmful if brought into contact with the eyes. Activities where chemicals are handled and processes that produce mists, sprays, dusts, fumes, or vapors, or result in chemical splashes are the most likely to be hazardous to the eyes. The effects of chemical contact to the eye can vary from apparent effect to irritation to severe chemical burns. The severity of the reaction depends on three main factors: the concentration of the substance and its capacity to do harm, the amount of substance that enters the eye, and the length of time that the substance is in the eye. The eye can be seriously damaged by exposure to intense light and other sources of radiation. Radiation hazards can be both visible and invisible. Types of radiation that can injure the eye include ultraviolet radiation, infrared radiation, microwaves, X-rays, and lasers. Ultraviolet radiation, which is generated by the sun and such activities as electric arc welding, can damage the cornea. Exposure to infrared radiation, which can come from sunlight and from activities such as working with molten metals, can cause cataracts or clouding of the lens of the eye. Laser radiation can be in the visible range of radiation, in the ultraviolet range, or in the infrared range. Most lasers used in industry are of relatively low power. However, some, such as those used in metal cutting, are much more hazardous. The retina is the most vulnerable to laser damage. Equipment or processes that pose a hazard in terms of radiation include welding equipment, laser equipment, X-ray equipment, high-temperature heat processes, or anything that generates radiation or intense light. The damage that can occur from exposure to any radiation hazard will depend on the wavelength of the radiation, the duration of the exposure, and the intensity of the radiation. There is also another group of eye hazards that exist in the workplace. Although this group does not have the potential to cause severe or sudden eye injuries, it is nonetheless still important. Poor light levels, either too little or too much, can lead to fatigue, general eye irritation, headaches, and stress. Job tasks that require intense visual concentration can have the same effect. And finally, intense visible light or glare can dazzle the eyes or cause what is known as light stroke, snow blindness, or welder's flash. This can cause temporary blindness or disorientation, which could in turn lead to associated accidents occurring. Having looked at the different kinds of eye hazards encountered in the workplace, the obvious question is, what can be done to prevent eye injuries from occurring? As with all other hazards in the workplace, eye hazards must be identified, evaluated, and, whenever necessary, removed or controlled to reduce associated risk levels to acceptable workplace standards. The ideal control measure is the elimination of the substance, process, or activity presenting the eye hazard altogether. Examples of elimination that could apply to eye hazards include following good housekeeping practices, where, for example, protrusion hazards can be removed, or using a supplier to handle a particularly hazardous process that they may be better equipped to carry out. Substitution is the next best alternative for controlling eye hazards. For example, can a hazardous substance be supplied in a safer form, such as a powder rather than a liquid, or in a lower concentration, and still effectively perform its function? When elimination or substitution options are either not practical or not possible, engineering or administrative controls must be used whenever a hazard needs to be controlled. Engineering controls are many and varied and include such things as the provision of guards, shields, and interlocks, the partial or full enclosure of a process or activity to remove or localize a potential hazard, such as the use of screens during welding activities, and the use of ventilation and local exhaust systems to remove potential airborne contaminants before they can enter the atmosphere or accumulate to unsafe levels of concentration. Administrative controls include things such as the provision of warning and information signs, the scheduling of particularly hazardous tasks when few people are present, establishing maintenance schedules, conducting monitoring procedures to identify the presence or the level of hazardous substances, and, most importantly, the development and implementation of written safe work procedures. In many cases, it will require a combination of 2 or more control measures to adequately reduce levels of risks associated with particular eye hazards. When, however, the risk cannot be reduced to an acceptable level, the use of personal protective equipment must be adopted as a control measure. The use of personal protective equipment as a control measure to reduce the likelihood of eye injuries is vital in a number of different circumstances, including things such as cutting, grinding, and drilling activities, and of course, when carrying out any kind of welding activity. Personal protective equipment also has another important role, particularly in regards to eye safety. This is as a last line of defense should an accident occur. Eye protection must be worn in any designated area and for any job task where a safe work procedure has identified the need for appropriate eye protection. The selection of the appropriate protective eyewear is also vitally important. A major factor in many serious eye injuries is that the victim was wearing the wrong kind of eye protection rather than no protection at all. All eye protective equipment must be appropriately selected and individually fitted for the required task. The equipment should be selected according to 2 main criteria: the nature of the hazard, for example, flying metal fragments or chemical splashes, and the work process involved, for example, welding, grinding, spray painting, or working with power tools. The 3 most common types of eye protection are safety glasses, safety goggles, and safety face shields. Safety glasses often look like normal glasses, but are specially designed to offer protection from flying particles. Safety glasses have impact-resistant lenses and strengthened frames to withstand the impact of objects traveling at high speed. Standard safety glasses can be supplied with tinted lenses to protect the wearer from glare, and side shields to guard against particles coming from the side. Regular glasses should never be used to protect against eye injuries. They simply will not offer an adequate level of protection. If an individual requires prescription lenses, they should be provided either with prescription safety glasses or equipment that can be worn over glasses or contact lenses. Safety goggles provide an extra level of protection against eye injury hazards. Goggles form a protective seal around the eyes, preventing objects or liquids from entering. To allow for airflow around the eye area, safety goggles can come with 2 different kinds of ventilation: regular or indirect. Indirect ventilation is required if the wearer is exposed to the possibility of hazardous chemical splashes. Face shields by themselves do not provide complete eye protection, but do provide significant protection from many hazards, particularly from flying objects and heat hazards. When working with intense light sources, such as lasers, protective eyewear must be chosen with special care. The lens filter must be an appropriate match for the level of hazard. Protective eyewear should fit properly and be comfortable to wear. Dirty or scratched lenses should not be used, as they can obscure vision and create an eye hazard in themselves. If, despite precautions, an eye injury does occur in the workplace, it's important to know what steps to take to quickly treat the injury and minimize the damage. Emergency and first aid procedures for eye injuries should be familiar to everyone. The type and extent of the first aid given will depend on the nature of the injury. First aid should be followed by medical assessment whenever there is any obvious physical damage or the possibility exists that internal damage to the eye could have occurred. Dirt and dust can be treated by flushing the eye with clean water. Use an eye wash station, running water, or a container of clean water. Do not rub the affected eye, as this may cause scratching or other damage to the cornea. If a foreign body has actually penetrated or become embedded in the eyeball, do not attempt to remove it or flush it out. Help the casualty into a comfortable position, preferably lying on their back, and advise them to remain as still as possible. Cover the eyes with a clean, sterile pad, ensuring no pressure is applied that could add to the injury. Advise the casualty not to move the eyes and seek medical assistance immediately. Do not touch the eye. If the eye has suffered a physical blow, quickly apply an ice pack or cold compress to the area around the eye, not to the eye itself. Keep it there for 10 to 15 minutes to reduce pain and swelling, and seek medical assistance. If there is a cut to the eye or eyelid, the eye area should be bandaged gently with gauze and medical tape. Medical assistance should be sought immediately. Do not apply pressure to or rub the affected area. If a chemical comes into contact with the eye, immediately flush the area with clean water, holding the eyelid open. Make sure in this case that the fingers are clean and have no chemical on them that could make the situation worse. The use of an eye wash station is the ideal way to flush away the chemical. If running water or a clean water container is used, make sure the head is tilted so that the unaffected eye is not contaminated. This flushing process should continue for at least 10 to 15 minutes. Again, medical assistance should be sought to assess any damage and carry out any additional treatment that may be necessary. For burns to the eye or eyelid resulting from extreme heat, the area should be flushed with cold running water for at least 10 minutes, eye lightly padded, and medical assistance sought. Eye injuries can be devastating, but they can also be prevented. The key components of workplace eye safety are an awareness of all the potential hazards that may exist, a commitment to abide by all warning signs, a commitment to always follow established safe work procedures, and finally, to wear appropriate eye protection whenever it is required.